friends. This is Dr. Lalit Mittal from Giggles Clinic and my own space. Now, in this video, I'll try to describe about the important differentiating features between a true ADHD and a hyperactive child. Now, first and foremost important thing we should always remember is that in ADHD, which is called by the name Attention Deficit Hyperactivity Disorder, there are three important parameters we should always consider before labeling any child to call it as an ADHD. The most important factor is age. Now, as per the guidelines, a child cannot be labeled as an ADHD before the age of 4 years. The second most important thing is hyperactivity. Now, how we differentiate, how we call it as a child is hyperactive, or it's actually a misbehavior, or it is due to the communication deficits, or due to the sensory factors. Now, a hyperactive child will always be hyperactive in every environment, whether it is a school, whether it is a playground, whether it is a home, or with every member of the family, or with every member of the family, or other teachers, or the parents, or the caregivers, or any other factor. Means to say, his hyperactive behavior will not vary from person to person, from environment to environment, and it will not be specific, it will be generalized. So this is the most important feature, because the second most important thing is that impulsivity. Now, generally we feel that we have listened, or we have seen that parents generally complain कि बच्चा सुनता नहीं है, एकदम से भाग जाएगा, he will not wait for the turn, he will be very impulsive, he will not be listen to the full command. And generally ये जो problems आती हैं, they generally come after the age of 4 to 5 years, जब बच्चा स्कूल में जाता है in first and second grade. Generally parents and the teachers, they complain कि बच्चा सुनता नहीं है, जल्दी से उसको कुछ अगर आता होगा जवाब, he will immediately run to give the answer. So that indicates impulsivity. That is, the waiting time is not there. The child should wait for the turn. The child should have that waiting period. That is lacking. The another important feature is hyperactivity, that is inattention. Now, inattention means that the child is not able to focus on small things. For example, अगर mother उसको बोलती है, a 3-year-old child or a 4-year-old child, कि आप stack करो, या ये small activities, ये छोटी activities है, coloring यहाँ पे करो, या you have to do along the borders, or you have to make a stack of 5 cards, whatever small activities, they may not be able to concentrate on that. They may be fidgeting, they may be looking here and there, their focus may be diverted, they may be disturbed by the other sounds or the background music. So that indicates focus, that is lack of attention. So these are the three most important parameters, that is hyperactivity, inattention, and impulsivity. Now, if these three parameters are present in any child who is above the age of 4 years, we can think of that yes, the child may possibly lie as an ADHD child. But to confirm the diagnosis of ADHD, there are certain scales are there. The most important scale which we use is called as Vanderbilt scale, which is used for the parents as well as for the teachers. So on the basis of this scoring, we label a child as an ADHD child. So the reason why I'm telling this, because in most of the cases, the children who are on the spectrum, they do have some sort of hyperactivity, they do have some sort of a lack of attention, but we cannot label a child on those bases as an ADHD child. So I believe the cases of ADHD are basically being overdiagnosed in the spectrum kids. The reason why we always forget, हम हमेशा ये चीज भूल जाते हैं कि जो बच्चे स्पेक्ट्रम में होते हैं, they have lot of issues. They may be having sensory issues in the form of proprioceptive, vestibular, tactile. They may be having lack of speech, lack of communication. They may be non-verbal, or if they are verbal, they may be only limited to their need or need-based. Or some of them may not be even need-based. They may be not non-verbal. They may not be able to express their feelings. And other factors which are there, most important is behavioral factors. Now, these behavioral issues, either in the form of attention seeking, tangible behaviors, sensory seeking, or medical issues in the form of constipation, diarrhea, reflux, adenoids, sleep disturbances. So these factors may invariably result in the form of an hyperactivity, as a result of which we generally mislabel them as a child on the ADHD spectrum. So the most important thing that we have also seen that many of the parents and professionals, they do start with the kids on the spectrum, labeling them as ADHD, even though they are less than age of 4 years, starting on methylphenidate, atomozidine. Now, this is very, very important for the professionals as well as for the parents, that methylphenidate and atomozidine, these are the two drugs which are specifically given for the children on the spectrum of ADHD, not on ASD, on the spectrum ADHD, and they should be given above the age of 6 years. These medications are only prescribed for ADHD kids above the age of 6 years. Now, another important thing is that generally एक बच्चा है 2 या 3 साल का, वो स्पेक्ट्रम में है, अब वो बोल नहीं पाता, ही इज नॉट एबल टू एक्सप्रेस, अगर उसको कोई चीज चाहिए ही इज नॉट एबल टू एक्सप्रेस, or he has a lot of sensory issues. Either he may be jumping, he may be jumping on the floors, he may be screaming because of visual streaming, because of auditory sensitivity issues, he may not be listening to the parents. So these things are पार्ट ऑफ सेंसरी इश्यूज. तो एज अ रिजल्ट अगर बच्चा कोई जंप कर रहा है, वो इधर से उधर भाग रहा है, he may be jumping, he may be having toe walking, he may be jumping on the floors, he may be screaming, he may be running here and there, we label the child as an ADHD. No, we cannot label a child as an ADHD, because the most important thing we always forget is we have to look into the sensory issues of the child. The child may be having tactile issues, the child may be having proprioceptive issues, they may be having vestibular issues. So unless and until we are not dealing with these vestibular, we are not dealing with these sensory issues, and if these sensory issues are not resolved, we cannot tell a child he is an ADHD. Other important factor is बच्चे का communication बहुत hamper होता है. He is not able to express his demands, he is not able to express his needs. For example, if he is going in a new environment, a 4-year-old child who is on the spectrum in moderate category, and his speech is need based, and is going to a new environment for the school for the first time, he may be very anxious. He may be the sensory overload may be there, either due to various noises or due to the overcrowding. He may not be able to understand the teacher's command because of the poor reception, or if the reception is good, he may not be able to express his needs. So as a result of which, what happens in that case, the behaviors start coming. He may be either doing some mischief things, he may be biting, he may be throwing things, either because of sensory overload, or maybe taking the attention of the teacher, so that the teacher looks at him and he may be able to fulfill his demand what he wants, because he is not able to express. So that things comes out in the form that the child is an ADHD. He's hyperactive, he's throwing things, he's beating other people, he's pulling hairs, he's banging head. So these things have to be, these factors or these behaviors have to be ruled out either through the sensory factors or through the communication factors. And once these factors are, unless and until these factors are not ruled out, we cannot label a child with ADHD. The child as an ADHD. So to summarize, I would say that a true ADHD child from an hyperactive child, or who is having hyperactivity due to sensory issues, communication issues, or various other factors, behavioral issues. So the important thing is that a true ADHD child will always behave, will always remain in a state of hyperactivity in every environment, whether it is with the parents, whether it is with the teachers, whether it is outside. Whereas a child who is hyperactive due to sensory issues or other factors due to communication will not be hyperactive in every environment. He may be hyperactive where there is lot of sensory overload, or where there is lot of stimming issues are happening, either as a result of sensory overload, or where he's not able to express his demand, where his communication is not being understand by other people's, either in the form of non-verbal gestures or prompts, or when he's showing behaviors either in the form of attention seeking or tangible behaviors, when he wants something and that thing is not being fulfilled, but he cannot express, so he's showing behavior towards a tangible thing. Other important thing is that we cannot label a child unless and until he is the age of 4 years. A child who is above the age of 4 years and who is a verbal and not much sensory issues due to these behavioral issues have been ruled out, and the child has undergone these Vanderbilt scoring, and then only we can label as a child as a ADHD. So these are some of the basic parameters which help to distinguish us as parents and professionals between a true ADHD child and an hyperkinetic or hyperactive child due to the sensory or other factors of the spectrum. The reason why I shared this video is this, because most of the times I have come across parents and as well as the professionals where we basically overdiagnose an ADHD child who is lying in the spectrum, and we invariably start with these medications of methylphenidate and atomoxetine, thinking in terms of treating them on an ADHD scale. But we always forget the underlying factors of sensory issues, the communication issues, the oral placement, or the oromotor sensory issues, as these sensory things are the major backbone of our whole system. Unless and until we do not resolve these things, we will not be able to fulfill the basic problems of spectrum or an